On June 29, 2023, U First Services held a press conference to present the SteriSpace unit installed at Schoellkopf Health Center in Niagara Falls, New York. This installation will improve the quality of life for the patients and employees through a higher standard of air sterilization.
The United States has always been a leader in research and development and has remained in the forefront of introducing cutting-edge technologies to impact millions of lives worldwide and provide them with meaningful health care. Introduction of this technology is another big step in this direction. The current pandemic has changed this world. It has changed the way of living by impacting the communities and the governments worldwide, by inflicting unimaginable morbidity and mortality, and at the same time denting the economy worldwide a big way. This has also, the changing healthcare realities have also changed the outlook of different stakeholders all over the world to look at their preparedness and readiness to combat the future pandemics, as well as to reassess their ability to react to the current medical emergencies. According to a recent press release from the World Health Organization, about 15 million excess deaths happened during this pandemic. Although World Health Organization has lowered the alert level on COVID-19 pandemic, but they also stated that the threat of COVID-19 is far from over. They've also emphasized on the governments of different countries and different stakeholders to mobilize their resources, to utilize the knowledge that they have, and to come up with the plans and technologies to combat the future pandemics with a greater sense of preparedness and readiness and quickness. Infection is a dreaded word nowadays. We as human beings, we want to socialize. There are pathogens all around which are microscopic. They are invisible. And it's extremely hard, it is impossible to have a social distance from these pathogens. Airborne diseases have for long affected the humans as well as the animals. And there have been numerous pandemics in the past 100 years. As Dr. Schwartz stated, 1918 there was a Spanish flu, 1957 there was Asian flu, 1968 there was Hong Kong flu, in 2002 there was SARS-CoV-1, in 2009 there was influenza, and in 2019 came this COVID-19 pandemic, which has been very deadly. Besides the pandemic, there are a number of other airborne diseases that are affecting us on a daily basis, like flu, which is a big problem to deal with. According to CDC estimates, from year 2010 to 2020, 1,000 to 52,000 people on an average died every year. Tuberculosis, which is a very serious airborne disease, is one of the major as a silent killer, is 13th leading cause of death amongst all diseases and second leading cause of death amongst the infections after COVID-19. Nursing homes, there are about 3 million American people living in nursing homes. And this is the most vulnerable population because of their age, because of the comorbidities that they have, and the decreased immune response they have to react to any kind of biological threats. During this COVID-19 pandemic, this population was the worst sufferer. We also know, and we have credible reasons to believe, that in the future coming years, there will be increased frequency of infections, whether they are natural or they are man-made biological threats. There are numerous labs that have come up all around the world, and they are doing research on various pathogens, obviously, in response to this pandemic. And many of these pathogens may be very contagious, and they may escape the labs and lead to catastrophic situations.
Technology has prevailed, and you're here to experience the opening of this very, very significant technology that will literally sterilize in your end.
This technology certainly is cutting edge, and I'm proud that our hospital here in Niagara Falls will be at the forefront of presenting this into the medical industry, as well as hopefully into industries beyond, education, other large congregate locations. And so, again, I just want to congratulate the medical center on taking this bold step. I appreciate the researchers and the developers of this technology, and I look forward to other opportunities to assist the medical center to once again continue to be at the forefront of this industry as well as of technology.
This is where we begin to learn how government needs to respond to community, is when we are embedded in the organization and in the systems that really need voices to be shared about what they need. So this air sterilization project is extremely important. One of the things that we learned during the pandemic is that most of us who stand here today were just fine when it came to COVID. We were able to be in our houses, safe and secure, shut up from the disease that was spreading so rampantly in places where people could not keep themselves safe. And so today we stand here acknowledging that government, that business, and that universities are needed in order to build stronger responses to systems of care that the most vulnerable need more than we do. And so this project is extremely important because it elevates those who are most vulnerable in our community. It elevates their need to say, you matter, you're important to us, and we're going to make sure that you are safe and you are protected when the rest of us get to be in our houses and protective spaces when diseases like this spread through community.
Government working with private sector to help fund technologies to protect those that have no advocates.
Reduce health disparities in Western New York by all working together, beginning at the community level and working up, instead of having meeting in Roswell Park. Tell everybody what to do from the top down.
I want to thank everyone here today, the administration of Niagara Falls Memorial Medical Center, the mayor and the city of Niagara Falls, and you first for bringing this to Schoellkopf Health Center. On behalf of the residents, the staff, our visitors, we thank you.